Hey, Dr. Verchek here. One question that comes up often is if should I address my lower face, neck, eyes, brow all at the same time, or should I split it up? And I have a few thoughts on that. So I used to do facelifts. I did an additional fellowship in facial cosmetic surgery, and I was doing facelifts and rhinoplasty and other full facial surgeries. But I've chosen to focus my practice around the eyes. I really love eyes. That's what I always felt like I was the best at, and I feel like eyes deserve a specialist that's dedicated to just doing the eyes. Now, there's a few reasons why I think it's a better course of action to operate on your eyes first and your lower face and neck second. First, eyes tend to age first. The skin is thinner, it's moving all the time from smiling and so forth. Second, when we look at someone, we look at their eyes. We rarely look at their neck. And so eyes are what kind of communicate your resting state. Are you happy, sad, tired, etc. Third, eyelid surgery is among the highest patient satisfaction cosmetic surgeries that exists. And so when I was doing facelifts, I would often do the eyes first, and I would find that people would then delay their lower face and neck because they were happy and they didn't feel like their lower face and neck bothered them as much anymore. And then a few technical reasons. So when we do surgery, swelling happens, and that swelling gets removed by our lymphatic system, so our lymph nodes. Well, our lymph nodes in our face are around our ear and kind of along our jaw. Well, that's exactly where a facelift surgery happens. And so if you can have your eyelid and or brow surgery with an intact lymphatic drainage system, you might have less swelling after surgery. Another technical reason, if you're doing everything all at once, it's usually like a 6-hour operation under intubation and gas. And I don't care who you are, 6 hours is a long time for any surgeon to concentrate and be on a razor's edge of focus. And so I find that a shorter operation, like a 1 to 1.5 hour operation, is easier to focus than a 6-hour operation. It's also easier on the patient to recover from a 1-hour operation than a 6-hour operation, and the anesthetic demands are less. So eyelid and brow surgery can often be done under just IV and local, no intubation, no gas. And so I found that my results were better when I could focus on the eyes. Additionally, when you do everything all at once, there's swelling from this that makes it hard to make the minute decisions that are critical for the kind of millimeter perfection that's needed for eyelid surgery. And so for all of these reasons, I find that doing eyelid surgery first with an intact lymphatic system on a higher sort of importance area, higher patient satisfaction area, shorter surgery, easier recovery is one way to go. So think about it. I hope that helps.